Good day, everybody, and thank you for starting your day the KUAM way. This is Crime Time, where we bring in the island's law enforcement communities and those people who are concerned with making Guam safe and a great place to raise your family and just to live. And we have got two outstanding examples of just that this morning. Of course, as always, we got the man right here, GPD Sergeant Paul Tapao, the Public Information Officer, and the man behind Guam Crime Stoppers. Well, you're one of several, Sergeant.
Yeah, thank you so much again for allowing the Guam Police Department to partner with KUAM. And, I want to thank Ms. Therese Arriola for taking the time out of her very, very busy schedule. She is the director of Guam Behavioral Health and Wellness Center, and very, very important month this year because, our efforts with the Guam Police Department, we focus on a lot of issues that deal with the island, but we couldn't do this without the partnership and, of course, that collaborative effort in ensuring the community stays safe without the efforts coming out of the Guam behavior. So, Ms. Arriola, thank you again for taking time out of your very busy schedule.
I was going to say, Therese.
Thank you.
Day, very good to see you.
Good morning, everyone.
And thank you for taking, again, some time out of, there is not a lot of it lately, especially in September.
September is really, really busy for Guam Behavioral Health. Thank you to KUAM, and thank you to GPD, and for the community for allowing me to be here.
And you're basically taking on a lot this month because your agency, you handle recovery on a variety of dimensions, but also you're handling suicide awareness this month and prevention, more importantly.
Yes, Guam Behavioral Health is really, really busy in September. We celebrate, or we highlight, two national awareness days, awareness month, and that is Recovery Month for drug and alcohol addiction, as well as Suicide Awareness Month. And of course, both drug and alcohol and suicide awareness, the reduction of suicide, is part of our mission.
Mm-hmm. Now, when you deal with the very delicate topics of suicide and drug and alcohol abuse, they're very personal matters. These are things that people tend to look to as a way out, or as a way of coping and everything like that. So, the sergeant told us many, many times, that he and his colleagues at GPD do so many things to make sure that people that are on these things, let's get them help. If you're doing something wrong, we're going to make sure that you stop that. But what can we do at home, and what can we as just average Guamanian citizens do to help?
Well, a lot, and it begins with awareness.
Yeah.
And the sergeant and I have talked many times. Chief Steve Ignacio is very on board. Mm-hmm. When it comes to suicide, the goal is for all 170,000 residents on Guam to have some sense of training so that we can see the signs. And the signs are sometimes very subtle, but more and more training in our community will have a better keen understanding and keen eye on watching for those subtle signs to be recognized, and to properly and safely approach somebody who you think might be contemplating suicide or taking their life. And so Guam Behavioral Health has free programs. We help train the community, but not only the community, but anyone really. We're in the schools. We have a very wonderful relationship with the Guam Department of Education. We are working with their counseling division, Nadine Cepeda. We're trying to get all 4,000 employees of DOE trained. GPD, our first responders trained, our community partners trained. Really the goal is all 170,000 people here on Guam to have some sense of training so we can have that keen eye to even try to recognize the subtle signs of suicide ideation. Mm-hmm. And so Guam Behavioral Health offers free training. That's the big word, free. And we will work with any organization, any business, any company to set up these trainings. And these trainings could be Safe Talk, which is the lowest level, and then assist training, and then a more intensive training for a body is called mental health first aid. Mm-hmm. And so these are three different types of training that anyone can avail themselves to. And all they need to do, if they're concerned about their family or their community or their church or their company or their nonprofit organization, give Guam Behavioral Health a call. We will gladly set up a training for you and your community.
And I just want to add the importance of the availability of the training in which Guam Behavior provides. You know, as first responders, you know, going through the Safe Talk and the Assist, being certified under Guam Behavior, one of the hardest things to do and to understand is that Guam, with the culture that we have, you know, within the Pacific region, Guam, for the diverse culture that we have, the numbers are high in suicide here on this island, and it
Abnormally
varies.
high, right?
It is
Alarmingly high.
Nationally, we unfortunately we claim those statistics, and those are statistics we don't want to claim. Unfortunately.
Yeah, so you know, I mean, understanding that even having that keen eye, but also having the courage to really be that person, you know, that voice for help, asking the question, just asking the question, are you contemplating suicide? Or are you having these thoughts? It's so we can do the training for a week, but for us to ask that in a mock situation, it's hard for us to come out. But this is reality of it, because you know we're teetering with lives, but knowing what we can do, equipping ourselves and arming ourselves with the tools that Guam Behavior provides, it's the first step in bringing the island safer and understanding what everybody needs to do in understanding suicide awareness. My daughter, who's also a part of the Youth for Youth initiative under Guam Behavior, has taken these courses and realizes that to hear teens talking about stressful situations at this day and age, and having her, who's only 16, 17, asking the hard question. You know, she even asked me, Dad, how hard is it to ask that question? I'm like, when the time comes when you have to ask that hard question, you need to be there for that individual that you're helping and you're servicing, because that care, that immediate bond that you make with that individual, it's gonna last a long time for that.
It's a very heavy topic to deal with.
It is.
and especially
It
for
is.
young people. But I would maybe say that people that are going to ask that question when they're unfortunately probably put in the situation, most people would probably happily discover they're a lot stronger than they think they are. If you're trying to help a friend or a family member or somebody in
and
church.
again, it's all about training.
Yeah.
You gain the skills to safely and appropriately approach.
Yeah.
And because I think the fear is not really actually the words. The fear is, am I going to approach this wrong and lead this person down,
Yeah.
further down the path of thinking of suicide?
Right, I'm
That's
not
the
a formally
fear.
trained grief counselor. I'm not a member of clergy,
I
or
think
I'm not
that's
law
the
enforcement.
fear. So
I don't want to do more harm than
remove
hurt.
that
Help, right?
fear, you have to just go through the training, and the training will tell you. Once they will put you through steps of, it's not somebody who's thinking of suicide. Being asked the question is not going to push them any further.
Yeah.
They're already there. If anything, it's going to show them that somebody cares. And really, that's what suicide is about. It's about that
Yeah.
hopelessness, right?
Yeah.
And so, again, the goal for Guam Behavioral Health is to have as many residents of the island trained in one version or another, and to bring that suicide rate that Guam so claims, and it's so high from the nation, compared to the nation, down to zero. One life is way too many.
Yeah.
Every life is precious. Every life goes through ups and downs, but it will pass with the proper care and the proper support.
We're all members of this family on this
We're all
island. No one
members
is
of this
insignificant.
family. Absolutely. And so Guam is, especially Guam, we're so small, you know. When suicide happens in a family, unfortunately, the person who takes their life may think it's the easy way out for them, but the aftermath
Yeah.
is I don't even know how to. It's so impacting in so many generations of that home.
And the survivors, you know, we're speaking
Grief.
about we're speaking about the impact that it causes, right? Going through the courses, you understand who's survivors, you know, who are the survivors, and it really is the parents, it's the family, the immediate family that's felt with that unanswered question: why? What could I have done? What could I have done to prevent this from happening? And you know, it brings to light, because our efforts with the Guam Police Department, and I've worked with Miss Arriola when she was the director for Sanctuary, and dealing with the at-risk kids. And when we say at-risk kids,
Yes.
these are kids who are exposed to issues in which they're dealing with in that set of culture. and understanding our efforts and how we're going to navigate our programs and focus on. When we did our Fade Away from Violence just recently during the closing of the school year, one of our main topics, and I want to thank the staff from Guam Behavior for providing that safe talk. We teamed up with Game Time, and Game Time was really instrumental. And to see and to hear the kids, just to ask the question, how many of you guys present here today? We had over 150 kids when we first did our Fade Away from Violence. Just the question that was asked, ever contemplated suicide? And it started with one individual had the courage, to seeing over 130 kids raising their hand. That's alarming. That really is. And these are teens. And understanding where our work and what our responsibility is now as service providers, it's a greater impact in what we can do to understand the signs. It's a greater impact in how we can do to provide that arm, or to provide the care and to provide the support, not just in the Guam Police Department, but also facilitators such as teachers, counselors, and even coaches. So,
And I want to
seeing the impact, it's. I was alarmed. I had to take a step back.
150 and about 130 kids raising their hand. That's what, 90%?
Yeah.
Over 80% of a teen pool saying they've actually thought of it. I mean, it's too much. So, our kids are our future, right? I mean, it sounds like a cliche, but it really is.
It is.
We
yeah.
really need to take care of their minds, and we need to guide them properly and get them the proper help, because the stresses of teen life is real, and it's very real to them. But there's ways to deal with that it never leads you down to taking your own life, and where you're left with your loved ones asking, what could I have done, or how did I fail them? And so
is that part of what part of the training is? Is you ask of someone who's having those very dark, very secluded, very subjective thoughts and everything. Think about what you'll impose upon your family, and think about the impact you'll have on them.
Yes, the more intensive training goes into
I would think that would be effective for some
Absolutely.
people.
And so, it's probably the right time. The chairman of Ways and Means, the budget just passed, the chairman of Ways and Means, and we are so pleased with the senators who voted for the budget, because they added actually $300,000 to Guam Behavioral Health's budget for youth first mental aid training.
Yeah.
And so the community is clear what we need to do. We need to train, and we need to try to touch as many people in our community with some sort of suicide awareness training. And I guess the senators saw the wisdom in providing more money for mental health first aid training, and specifically youth, because when you touch the Guam Department of Education, you touch 36,000 kids at one time.
Yeah.
And so our relationship, those funds will go a long way in assuring that the 4,000 plus employees of the Department of Education actually gets the training within a year. So,
Well, of course, this
very
was
happy.
one side of the two-sided coin. September is, of course, not only Suicide Awareness and Prevention Month, but it's also Alcohol and Drug Recovery Month. So you're joining us live right here on Facebook Live with Sergeant Paul Tapao from GPD and Therese Arriola from the Guam Behavioral Wellness Health and Wellness Center. That's a long title.
We call it the spa.
this
We
spa, okay.
call it the spa
Yeah.
because these guys provide the help that we need.
And of course, the entire month of September is dedicated towards suicide awareness and prevention. That's
And
one side of the
both,
coin.
right.
Let's talk about the drug problem we have here on Guam.
Recovery month.
It permeates the entire island. It's very, very serious, obviously. Sarge, you've talked about that so much. But now when we talk about recovery, for people that have made it a little bit too far down that very slippery slope and everything, what are you doing to actually treat the people that have been a little bit too much?
Well, Guam Behavioral Health is, we have a drug and alcohol division, and it's commonly known as New Beginnings.
Yeah.
And so New Beginnings is our drug and alcohol department, and September is a recovery month as well as Suicide Awareness Month. So yes, we're very, very busy at the department. The one message that I want to put out to the people of Guam is, if you find yourself struggling with drug or alcohol addiction, give us a call. There really is no stigma in getting help. The shame would be not to get help. and not to begin the path of healthy recovery for your life.
The worst decision you can make is no decision at all.
Absolutely,
Yeah.
absolutely. And so Guam Behavioral Health through New Beginnings Division offers outpatient and intensive outpatient drug and alcohol recovery program. And that's anywhere between, from assessment to personal counseling to family counseling, weekdays, after hours. I mean, all these things are available if someone really, really wants to get back on the path of recovery and healthy life. And
What are the steps to treatment, Therese? Like when someone goes through that program and everything, it's not a top secret, highly confidential like process and everything like that. But when people are being
first thing they need to do is they need to come in and get assessed.
Yeah.
And we will determine what level of program that they best fit in. And they will be referred to one of either an outpatient program or an intensive outpatient program. The good news is, in the highest step of recovery, is come September. I was really hoping to get it done in September because of Recovery Month, but we're not quite there. But definitely in October, Guam Behavioral Health is going to reopen their detox
It's important.
unit.
Yeah.
very good.
And so that is something I think the island will be very proud to have and is necessary, because there's a lot of people on Guam that need a little bit more than the outpatient services we provide, but because the island doesn't have a detox unit to properly detox you down medically and professionally, only those, the best we can offer them is the next step, which is intensive outpatient. But some people really do need that medically assisted, clinically, medically assisted inpatient detoxing. And only those that unfortunately have the means and the funds to go off island to a Betty Ford or to a...
Which are very few people on Guam.
Which are very
Very
few people
expensive
from,
too.
Yeah, exactly.
will be able to. But it's some level of recovery is better than no level of recovery. But the good news is that come October, we're going to have our detox unit at Guam Behavioral Health. So it's an inpatient, and so we're very excited about it.
And that's important because when we featured, I had the I guess the good Lord's direction
Yes.
when I ran into Jesse Mendiola. We featured him 2
last
weeks
week,
ago,
or-
and it was really I was fielding calls about how can I, people wanting to seek help, and Guam Behavior was the top of the list, and I kept referring people. And yesterday at Guam Behavior, and when I was leaving, I ran into Bianca, and she too was also feeling concerns from our female constituents who want to seek help. And hearing this and knowing that, understanding that recovery, it's going to require not just the individual, but the family support, but the entire
Absolutely.
community to come forward. And I really like how you said, it's not a stigma. This is where
Oh no,
the
in this
individual
day and
has,
age,
it's not.
the
it
stigma
really
is not to seek help.
Yeah, we have to push this forward.
We're an open community. We talk about everything, and so recognizing, knowing that you're going down a slippery slope, that you can't recover on your own, you have to seek help. It's a shame if those who don't, and because it's different if we don't have the services of Guam, but we do. So I'm telling everyone out there, if you feel like you're depressed or you feel like you can't get out of your drug or alcohol habit, or you're contemplating suicide, give Guam Behavioral Health a call. I mean, we are here, that's what we're here for. We are a government of Guam agency that's here to assist.
And I feel we do need to cover one thing, both with respect to Therese and the Sarge, because even though there are these resources to treat people and get people, get them on the path to recovery and hopefully make sure that they don't slide back into that, like you said, a very slippery slope. Sarge, GPD's trying to nip the drug problem in the bud.
Yeah.
And again, you guys are not messing around when it comes to this. So maybe can you tell us what punishments await people that that abuse drugs or abuse alcohol? Because some people might be watching us right now and saying, okay, if I have a problem, I can go through the program. I'll be good from that. No, you can do some very serious jail time.
That's clear. The picture in itself will showcase what can happen. but to the extreme to see what's really happening on the island, right? I used to be at Highway Patrol and seeing people suffering to alcohol addiction. You know, we have the saying, you know, it's a functioning alcoholic, but really, the consequences that can happen is a life that's lost. And when you put the two situations together, addiction and suicide, that's the worst thing that can happen. That's the worst case scenario, is that when you have somebody that's down and out and battling through addiction and there's nowhere to go, and they go down that black hole, and it really is just a dark tunnel with no light and no, that, you know, we want to take what the court proceedings will provide and everything. And right now, it's what we have to do within the government agencies. It's our responsibility. Mm-hmm. But if you look at it as an individual approach, you look at what the consequences are going to happen. You lose your family, you lose your loved ones because of addiction, and then you move towards this dark tunnel where now the contemplation of suicide, because you have nothing. You have nothing. But
people with children can lose their children.
Yeah.
They'll lose their jobs. I mean, there's so much negative
impact.
Yeah. Not only losing their loved ones, but especially possibly losing their children. You know, and God forbid that they're on either a drug or drinking too much, and they get behind a car and then hit another life and impacts another family.
Yeah.
And so
it's a ripple effect.
It's a ripple effect, and unfortunately, drug and alcohol seems like it's a personal thing because I'm taking the drug, I'm taking the alcohol, but really it affects
everyone.
2-3 degrees around you,
and moving forward, you know, with what Guam Behavior has, you know, to provide the help. That's the light. That's the light that Jesse Mendiola alluded to. That's that light that he saw, that he said, he can, as an individual, he can stick his hand down that dark tunnel and provide the help. But now you have the full support from the government agencies to battle this issue, you know, and we're going to tie everything together. We as first responders, we armed ourselves with the knowledge in how we can do interdiction to prevent suicide. Because we're there, we're the front line. We're the ones that they're going to call, and working closely with them, but also knowing that treatment, whether it be clinical, whether it be social support, it's available to our constituents, our Guamanians who are suffering through addiction. It's available to Guam Behavior. We do the prevention and education, we'll do the drug interdiction, and here's where the help, here's where the treatment, here's where the social support comes in with Guam Behavior.
I want to talk a little bit about how first responders, so Guam Behavioral Health put together a mobile response stabilizing system, and really what it is, it's taking Guam Behavioral Health counselors and psychiatrists, first responders at Guam Behavioral Health, first responders, emergency first responders like GPD and GFD, Guam Fire Department, and trying to coordinate the efforts. So, for example, when a call comes in, and there was one, I'm not sure whether it was a year or 2 years ago, at Two Lovers Point.
We put it together
and
in a team.
they figured immediately, the first responders immediately figured out it was a suicide attempt. So what happened was they called the team together, the MRSS team, what we call it, Mobile Response Team, and everyone came to the site, and they wraparound service at that site, at the moment of sight, to properly bring that person down to a safe level. And so, again, lots of training, full circle training. Guam Behavioral Health counselors, psychiatrists, first responders, all getting the proper training so that when the call comes in and it's immediately identified that's either a suicide or a drug addict or an alcohol, chronic alcoholic, or even somebody with mental illness, the approach is very sensitive and very, very strategic versus lack of training, and everybody is approached in a very, everyone's the same. No, not everyone's the same. So we're trying our best to have that wraparound training so that everybody can adjust, be armed with the tools to say, okay, this is a suicide attempt. protocol this kicks in.
Yeah.
This is a mental health patient. We don't approach them. We don't approach mental health patients with the same as you would to any other person.
Yeah.
You know, there needs to be that compassion, but yet the training to approach them properly.
And that's what differentiates us from the States. Have you ever seen the videos in the States and how they handle individuals with
Same.
emotional disorder? It's really, you know, you get a first responder out there, but you have the support team and you provide the safety, you're the safety net between the community, but you're still in the front line addressing the person that's struggling or that's going through emotional disorder. But we have the team to assess us. In an event where we have to get physical and restrain the individual, we know immediately where to transport and where to provide the care, where the immediate care is going to be. And working tandem and closely with Guam Behavior, this is where the partnership comes in. This is where the training allows us to better ourselves and protecting not just our officers, but the community that we serve. So, you know, Therese, thank you again for taking the time to you know, come out your busy schedule. This is a busy month.
Yeah,
It
well,
is.
let me ask, where will you be this month? Because, you know,
Okay,
to get
so-
the word out and to educate the
Yes,
island.
thank you. So, again, Guam Behavioral Health invites the people of Guam to celebrate and to bring awareness and get just more information on suicide prevention, as well as drug and alcohol addiction recovery month. And so it all starts this Friday. And so we invite everyone who is interested down to the proclamation signing that the governor will be signing. 10 o'clock will be suicide prevention, 10:30 is recovery month. And then Guam Behavioral Health's New Beginnings will have an open house around 11:30 Friday, right after the proclamation signing. And then because because drug and alcohol addiction is just rampant in our island, unfortunately, Guam Behavioral Health can't do it alone. And so I would be remiss if I don't mention that we do it with partners. And
Yes.
so Guam Behavioral Health expands its reach in the community. We have partners established with Sanctuary, for example, for children with drug and alcohol addiction, adolescents. So Sanctuary is your place to go. We have Lighthouse Recovery with the Salvation Army for men with alcohol and drug addiction, and Oasis for women. And so Guam Behavioral Health has contractual partnerships with all of these agencies so that our reach is greater, because really New Beginnings can't do it alone.
Yeah.
And
It's
so
a great battle. Yeah.
so we have partnerships with Sanctuary, Lighthouse Recovery, and Oasis for women. And so there are open house for these organizations planned for the whole month of September. Unfortunately, I did not bring the schedule, but if you will call Guam Behavioral Health at 647-1901, you will get all the information you need regarding suicide training. We're setting up a suicide training, and information that you need if you're interested in seeing any of the recovery organizations or programs.
All right, well, Therese, we thank you very, very much for your time, and we thank you for your service to Guam. It's
Thank
certainly
you very much.
worthwhile.
It's my pleasure.
Okay, well,
It's
thank
my
you so much.
pleasure.
And Sarge, a pleasure as always.
Thanks again, Ms. Arriola.
Thank
you know,
you.
this is really a testament of the partnership in the Guam Police Department and Guam
Absolutely.
Behavior. And of course, it's a reflection of the administration in bringing Guam closer and making Guam safer, the way, you know, in which we can all take ownership of our community.
We need to help our people.
Whether being able to address issues with suicide and providing the awareness, or really combating and battling addiction that's really tearing our fabric to our society. So,
Right.
you know, thank you for taking this time to really
Thank
be
you,
part
and
of
I
this.
appreciate everyone who has supported Guam Behavioral Health, especially the government of Guam employees, the Office of the Governor, and just, you know, we can't do this alone. We need
Certainly.
we need support like KUAM to continually help us bring that awareness out. I need to continue to have those relationships with my brother and sister organization in the government. We just can't do this alone. No one entity can do it alone, but together we can save lives.
And we'll keep up with you throughout the month and see
Yes,
how the progress is
yes.
going. So,
Thank you very
if you
much.
need help out there, everybody, suicide, drugs, alcohol, as we have learned today in our live stream right here on Crime Time, they are not the answer. So, if you know someone who's struggling, help them. If you are someone who's struggling by yourself, call Therese and her team, call GPD, get help, and make the call, because it can save a life. So, thanks so much for watching KUAM right here on Crime Time. We'll see you next time.